Maybe you have been dealing with a high blood pressure, heart failure, or maybe kidney problems, and your doctor prescribed you Benazepril. Then this video is meant for you. We will cover how and when to use it, what side effects it can cause, what dose you need, and much more. So make sure to watch the whole video so you don't miss any important information. Let's get started. As mentioned, the generic name of this medication is Benazepril and it's sold under the brand name Lotensin and is available as a tablet. If you wonder how to use it, just swallow the tablet whole with half a glass of water, and it's often advised to do so at a fixed time of day so you're less likely to forget the dose. Benazepril is an ACE inhibitor. ACE stands for angiotensin converting enzyme. These medications help to relax your blood vessels to lower blood pressure. Through this effect, Benazepril is used to treat high blood pressure as well as heart failure, and it lowers your risk on a heart attack. When taking Benazepril, it will gradually become effective within 2 to 6 weeks. Which brings us to the correct dosages to use. And here I want to mention that I can only provide you with a guideline. Always use the precise amount and frequency your doctor prescribed you, as your dosage might depend on your indication of use, your side effects, and the symptoms you might experience. However, for high blood pressure, most doctors will start with an initial dose of 10 mg once per day. If necessary, this 10 could slowly be increased up to a maximum dose of 40 mg per day. When taking Benazepril to treat a heart failure, the doctor might prescribe an initial dose of 2.5 mg once per day and increase it to 5 mg once per day after 2 to 4 weeks. If necessary, the dose from there could be further increased up to a maximum of 20 mg per day divided over 1 to 2 dosages. For kidney impairment, it's 10 mg once per day. Now, Benazepril is a very effective drug, but unfortunately it can also cause some side effects. In this video, I will discuss some of the most common ones, but always check out your leaflet, ask your doctor or your pharmacist for a complete list. Commonly, it could cause a headache, dizziness, fatigue, a cough, frequent urination, skin rash, and itching. Rarely it leads to a low blood pressure, chest pain, heart rhythm problems, and diarrhea. And very rarely it could cause myocardial infarction and renal impairment. Which brings us to the safety of use. Now, when using Benazepril, it can lead to dizziness, especially in the first few weeks. If you do experience this, then please be careful, as driving can be dangerous. Furthermore, Benazepril can have interactions with other drugs you're taking, so always discuss this with your personal doctor. Next, in moderation, it could also be combined with alcohol, although combining this medicine with alcohol could increase its side effects. Therefore, always be careful. And lastly, Benazepril could be dangerous for pregnant women and women which are breastfeeding. Always discuss this with your personal doctor. Now, I hope you know now how to use Benazepril, but if you have any questions, let me know in the comment section and I will do my best to answer each and every one of them. If you did learn something, please click the like and subscribe button. It will help out your channel tremendously, and in return you will get notified each week with a new awesome medical video. Also, check out the main channel at How to Medicate, the TikTok, Facebook or Instagram, and I will see you next week with a new awesome video. Bye bye.